if you could speak to, and this is well documented, you don't have to go far to find it, the discrepancies and discordances in DEXA are real.
Oh, yeah.
Positioning, calibration. So can you speak to that as well? Because you're talking about two different types of technology, DEXA versus REMS, right? One's ultrasound, one's X-ray. Discordances are less on REMS, and I think that's a point to make. So can you speak to that?
That was actually just published by Nick Birch. So he looked at all of his data. He has thousands of data points on REMS and DEXA together. And you can see on the same people that what's called discordance, meaning having a difference of osteoporosis versus osteopenia or osteopenia and normal bone. Having a discordance on DEXA is more common between sites. So like, hip and spine, for example, or one hip to the other hip. So that's more common than on REMS. It makes sense then that REMS is likely more consistent because osteoporosis is, unless you're not weight bearing, osteoporosis is a diffuse, it's a body-wide problem. The discordance doesn't make sense. And so if somebody's had a DEXA and their spine was -4 and their hip was -1, that doesn't really jive with the way that bone metabolism works. So I would want to look deeper into that. The different machines, different companies, different scanners. I mean, there are so many variables. If you were to drink a gallon of water before you do a DEXA and take a calcium supplement, you can totally change your DEXA score. You could change your T-score in a second. We can game DEXA. You just understand what the technology is and you can change the outcome of the score. Now, people aren't generally trying to do that, but that's the problem with DEXA is that it's just not great technology. It was needed at the time. This was in the mid-90s, but we're ready to move past that. The technology is here to do it. We need to move past it.